Hello everyone, and today we'll talk about gingiva. Okay, so so let's begin. The gingiva should be lightly dried before examination, so that moisture does not obscure subtle changes or detail. Color, texture, size, contour, consistency, and position are noted and recorded. Gingiva is then carefully palpated to express any exudate or pus that may be present in the circular area. So that means the gingiva should be uh, in the normal in the color. Okay, is pink. The color is pink, stippled and firmly bound bound to the underlying connective tissue, so it should be attached and pink to the connective tissue. And the free margin of the gingiva is knife edge, should be knife edge and sharply, okay, and look sharp pointed papilla fill the interproximal spaces. Okay, any deviation from these findings should be noted. So that means that any deviation from these, like pink, stippled and pointed and knife edge and sharply and fill in the proximal spaces, if it's not existed in the gingiva, so any deviation from these findings should be noted. Okay, now we will show image that explain a healthy gingiva and non-healthy gingiva. Okay, so if you see here, if you look at the gingiva in number A, so we will see a healthy gingiva is pink, knife edge. It's pink and knife edge. Okay, okay, and firmly attached to the connective tissue. When we explain that is attached to the bound to underlying connective tissue, that is attached to the tissue. Okay, and it's very healthy compared to the number B. Number B, gingivitis black and calculus have caused marginal inflammation. So if we look at this, it's marginal inflammation and calculus black. Okay, with a change in color, the color is not pink, and contour, of course the contour is swallowing, contouring, compared to the natural. Okay, with change, contour and consistency of free gingival margin, inflammation extends to the keratinized attached gingiva. So okay, this is unhealthy gingiva. The gingiva become enlarged and bulbous loss of stippling occurs. The margin and papilla are blunted and bleeding and exudate are observed. The width of the band of the attached keratinized gingiva around each tooth may be assessed by measuring the surface band of keratinized tissue. So keratinized gingiva or keratinized tissue. What is the keratinized gingiva? So we will explain it now. So this is the meaning of the keratinized gingiva. Okay, the keratinized gingiva is the part of the oral mucosa which covers the gingiva and hard palate. It extends from the free gingival margin, okay, to the muco-gingival junction. We will talk about muco-gingival junction. Okay, but let's focus about keratinized and what's the importance of the keratinized. Okay, and consists of the free gingiva as well as attached gingiva, the width of the keratinized gingiva. So what's the importance of the keratinized gingiva? The keratinized gingiva is an important factor when it comes to dental implants. This is because keratinized gingiva can play a role in the long-term support of the implant, may also aid in maintaining oral health. So it's meaning keratinized gingiva is very important, and healthy of the keratinized gingiva is very important for dental implant. So without health keratinized gingiva, the dental implant will not be successful. Okay, in preventing gum recession, so it's helped to preventing gum recession, and in overall aesthetic, due to this, the keratinized tissue of the gum around tooth or implant may require the tissue or skin graft prior to any dental procedure. Such a graft will assist with gum health as well as implant stability. Maintaining the health of the keratinized gingiva is important for both the function and look of a patient implant. So this is a very important. So that is a summary of the keratinized gingiva. It's very important for dental implants and preventing gum recession. Okay. And the width, okay, with a dental probe and subtracting the measurement of the sulcus depth. Another method of obtaining the measurement by visual. This is called. This part is to talk about how to measure a gingiva. Okay, we can use this tool, gingiva probe. Okay, 3 types of sulcus pocket measuring probes. Okay, correct position of peridental probe. Okay, this is correct position of peridental probe in the interproximal sulcus area, parallel to the root surface. This is parallel to the root surface. If we look at this, it's parallel to the root surface. So we explain the interproximal area. C and D graduate verification probe. Okay, these all probes instruments help to detect the gingiva, the healthy gingiva. Okay, so at the end we'll talk speedily about this image. What shows smile analysis is an important part of the examination, particularly when anterior crowns or fixed dental prostheses are being considered. Some individuals show considerable gingival tissue during an exaggerated smile. So this image is exaggerated smile, And if we look at that, when when the patient smile, so the gingiva is appear obviously, okay, and this is not a good factor. So because if we used a BFM, or that the margin will be appear like a black margin here, okay, and this is not aesthetic, of course, okay, and and of course when we when we used also Emacs or Zircon, and they are appontic, so it will be appear that is not a natural teeth, okay, that is not aesthetic, okay. We will take uh, we will take the proper or success treatment planning. So if we have this patient, for example, this patient with exaggerated smile and the gingiva, so what are the solution? We will use for example an implant, okay, to replace the pontic, okay, and especially with taking notes with the treatment of gingiva inflammation if it exists, okay, such we will talk about this, about healthy gingiva and unhealthy gingiva. So healthy gingiva, we will take an implant, okay, to replace a pontic, and unhealthy gingiva, we will treat the unhealthy gingiva, okay, to be good and more stable to withstand the implant, okay. And for example, we replace the BFM with Zircon or Emacs to reduce the black of the gingiva, okay. But in the line B, ovars may not show the gingiva margin, even central incisor, so it's very aesthetic, and we will not take a conditions to replace a restoration or like this, okay. So that is the end of our lecture today, and thank you for listening, and don't forget to subscribe our channel. Thank you.